So for adolescent acne, it's a complex mechanism. There's stress that's involved. There's changing hormones. We know there's an overactivity of the sebaceous gland. I say look at things that are inexpensive that you'll actually use. So Panoxyl is a favorite brand of mine. You can order on Amazon because, again, we're an impatient society, and oftentimes they have that prime delivery, which is either the same day or the next day. And you're talking for about $20 to $40 total for a full skincare regimen that works well. So for most teenagers, unless they're very, very thick skin, very greasy, I'm going to use Panoxyl 4% wash. It's tolerable for everybody from their young teens to their centurions, so 100-year-old patients, where we see that it's not going to dry them out too much. What else is there? We have adapalene. Adapalene, since the FDA allowed this to become an over-the-counter product, you can just vary it and show them with a little bit of education what they can do. So they don't even have to come to me. They can actually see, I don't have TikTok, but if you have TikTok, you can advertise on TikTok how to use this simple regimen. And they have a hydrocolloid patch that you can put on there. So all of this regimen, approximately $40, easy to use. But if you talk about a professional grade, what do? I start everybody on 2 items. One is called BioJuve that actually controls the human microbiome. So we talk about it for the gut and how we talk about probiotics. This is similar to a probiotic for the face. It enhances the activity using Zycrobe technology. It enhances the activity of our natural bacteria, which is going to be C. acnes defendans. And we always talk about C. acnes in general, but not the defendant subspecies. That's going to repair the skin, decrease transepidermal water loss, and it also works on the retinoid receptor. So pretty amazing technology. So that works great. If I can have the patient spend just a little bit more and do one other thing, I would add something called Pavise. Pavise is based as a sunscreen, but what it has is something called diamond core technology. The diamond core technology improves the overall regulation of the skin. It, again, decreases that bacterial activity, but it's in a natural way. It has other ingredients inside there, niacinamide, silymarin, tranexamic acid, but because of the diamond core technology, the amount of tranexamic acid as well as silymarin and niacinamide that are in there, they're much greater concentration that we would normally see because of that technology. And the other thing that it has that's very unique is pycnogenol. So pycnogenol helps those patients who have both melasma as well as any type of hyperpigmentation or heat sensitivity, and because it stops the heat shock protein from activating the melanocyte. And the second thing that it does for all of us who are, I'm in my 50s now, it stops the cellular senescence. So it keeps your cell young, active, and it continues that fibroblastic activity. So if you do professional grade, 2 products, BioJuve and then Pavise. If you're talking about over-the-counter, get it on Amazon. I go with my typical Panoxyl. Works fantastically well, very inexpensive.